Greetings everyone, I am Isa Angelica Amares and I will be introducing the case scenario about futility as well as the team members and their respective roles in this presentation. We, the Team 5 of NLM 202 KBB, will be presenting a case scenario about making decisions about futility in the healthcare setting. In this ethical scenario, Abdul, a 50-year-old retired engineer, came in for removal of his benign brain tumor. After the surgery, the patient went into a comatose, requiring him to be intubated and put on mechanical ventilation in the ICU. After 2 days of monitoring and tests, two of his physicians decided that Abdul would never again regain his consciousness and that the attached tubes that is making or keeping him alive could be removed. When the wife was informed about this situation, she became adamant of their decision due to their religious beliefs. The patient also has no advance directives that the healthcare team could follow. The healthcare team is facing a dilemma now on whether they should honor the wife's decision or to continue caring for a man that they assess to be biologically alive but no longer there mentally. The issue or problem in this case is providing life-sustaining measures to an incompetent patient. This case raises numerous ethical concerns about the appropriateness of care between healthcare professionals and families regarding the continuation of a patient's treatment. Healthcare professionals experience moral distress because they believe they are causing harm and suffering in a patient, and they know that a prolonged life on artificial supports causes great suffering in a patient, that they are part of the team that is prolonging the suffering and treating the person as a body rather than a sentient being. We are here now to conduct an ethical consultation about this case of futility. The roles are going to be played will be the ethical consultant, which will be played by yours truly, the nurse manager, which will be played by Rachel Lopez, bedside nurse to be played by Marinelle Guse, physicians, which will be played by Camille Takinan, and the wife of Abdul, which will be played by Palakmit Kaur. Now we are going to proceed with the consultation. The details of this meeting will be kept confidential, and all matters that are going to be discussed will be legally documented. Let us now hear the perspectives of the concerned people in this case. We will start with the physicians and their perspectives in this case.
Hi, I'm Mary. I am assigned doctor to Mr. Abdul. We did a series laboratory test and procedure, but apparently the laboratory results and according to his physical assessment, he is now in the state of coma. Here is my co-doctor Camille to give a further explanation regarding Mr. Abdul's current condition. Hi, I'm Camille, the attending physician of Mr. Abdul. The surgeries went successful, but apparently he developed a complication that causes blood infection. That's why he is in the state of coma. His brain is no longer functioning. He is dependent to the life support that keeps his heart beating and breathing as well. Mary and I collaborated with the other health team members that handle Mr. Abdul. As a physician, we did all the possible medication and treatment to fight infection. But unfortunately, Mr. Abdul, all the treatment, all the medication will no longer benefit him to improve and gain his consciousness. From the physician points of view, we decided to end all the treatment that Mr. Abdul is receiving right now for him to preserve and respect the client's life so he will no longer experience the suffering and the burden. So Mr. Abdul can experience the comfort care until his last breath.
Thank you, doctors. Now, let us hear from the bedside nurse.
Hi, my name is Marinel, the bedside nurse of Mr. Abdul. And as a professional nurse here in Ontario, I have professional accountability towards my clients. And being bedside nurse of Mr. Abdul, according to the physician, there's less or no chance of him waking up again. As a Catholic, I do believe in preserving life, but at the same time, I also doesn't want to see people suffering in the long term. I need to maintain professional boundaries, which I will respect whatever the patient or patient's family's decision regarding the condition.
Thank you, Nurse Marinel. Now, let us hear the thoughts of the wife of Abdul. Mrs. Abdul, let us hear your thoughts, ma'am.
I am Mrs. Abdul, wife of Mr. Abdul. I am well aware of my husband's current condition. The physician informed me that they are planning to remove my husband from his life support. But as a wife, I have legal authority to decide on behalf of my husband, and I cannot let this happen because it is against our religious values and beliefs. So even my family is not okay with mercy killing because we feel like it's like killing a person. So in this case, I have to check what process I can go through to get the authority to take decision on behalf of my husband. In that case, I am willing to pay whatever expenses it will cost us.
Thank you for that, Mrs. Abdul. Rest assured that we value and respect your beliefs, and all of this will be taken into consideration in the decision making in solving this ethical issue. And now let us hear from our nurse manager.
Hello, everyone. After carefully reviewing the case of Mr. Abdul and listening to all parties, I understand the side of Mrs. Abdul and her beliefs, which is the basis of her decision to preserve her husband's life. But what will be of utmost importance is the patient's well being. After undergoing several tests and trials of medications, it has come to my attention that those treatment has not been responding to Mr. Abdul at all. As a nurse myself, subjecting the patient in necessary pain and hardship when the prognosis is bad is tantamount to inflicting harm to the patient itself. Healthcare providers are sworn to do no harm, and prolonging Mr. Abdul will do just that.
Thank you, Nurse Rachel. Mrs. Abdul, we do respect and value your cultural beliefs. However, we cannot just follow your decisions for your husband because, as per record, he doesn't have any advance directives made available for us to use in this time of his health status for the decision making. And as per the CNO practice and guidelines under the Substitute Decisions Act, as a spouse or the wife of Abdul, you need to have a formal appointment of a decision maker through a power of attorney document through the office of the public guardian and trustee or through a court appointment. You can apply for this at the Consent and Capacity Board. If the court grants your request, our staff and the facility will have to respect and follow that. And with this, does anyone here from you who has any questions or anything to add?
It is possible for Mr. Abdul to continue his life in long term care facilities You would be able to visit him anytime you like and find comfort that he is still alive. However, you should consider the rising costs of long term care and might not cover your health card. In the long run, Mr. Abdul will be susceptible to infections because he will be on mechanical ventilator and other tubes that require proper care and replacement.
Okay, to sum up this ethical consultation, and we must agree on a decision for this. So, some key points regarding this ethical issue are: as healthcare professionals, we have laws and practice standards that we must follow. According to the CNO, every patient and their family have autonomy. That means, with a sound mind, they have the right to make decisions for themselves on their treatment. And furthermore, we are expected to have respect for life, allowing our patients to have dignity of life with respect to their values and beliefs. We also must maintain our commitments to our patients and their families by being truthful and presenting reality on their health status. Another ethics that we follow is the non-maleficence, or the act of doing no harm or preventing and or minimizing harm. In this case, the healthcare team members think that maintaining Abdul on mechanical ventilator is akin to torture. In addition, we must observe veracity, fidelity, and integrity to our clients and their families. This means that we must maintain loyalty, honesty, and faithfulness to patients and families who put their trust on us. And Abdul and his family trust the healthcare team that they will do as they wish, and the team must respect this and be truthful about this. This case is an ethical issue that placed the healthcare team into an ethical dilemma and led them into having an ethical consultation to discuss and solve the issue. So, in conclusion, hearing all the perspectives of every person involved in the care of patient Abdul, and considering all the ethical values, principles, and legalities, this ethical committee have decided to respect and follow the wife's decision, granting that she has a formal appointment of a decision maker of her incapable husband given by the court to her. And that's our case scenario for Abdul and Futility. Thank you so much and have a good day.